Good morning, everyone. Thank you very much for the invitation. Thank you, Dr. Hayat, for this opportunity. My presentation now is about the communication and medical sciences. Well, first, thought history problems related to medical communication have arisen evidence in the Toronto Consensus in the 1990s, which pointed out deficits in doctor-patient communication and its negative impact on medical care. The lack of effective communication is also reflected in frequent complaints received by institutions such as the National Medical Arbitration Commission. Globalization and technology have brought people from different cultures closer together, which has enabled change in culture and communication. However, it remains crucial and principles such as authenticity, emphasis, and a positive attitude facilitate communication between people of different cultures. Communication is considered as the process of understanding and sharing the meaning of something. According to the Business Dictionary, communication involves two ways: mutual understanding, where not only information but also ideas and feelings are exchanged. It is crucial for the functionality of an organization as it connects people and departments. The Royal Spanish Academy defined communication as the action of communicating, highlighting the transmission of signals through a common code between the sender and the receiver. Various authors have offered the concept of communication. For example, Aristotle considered it is a process where a sender transmits a speech to another audience in a specific situation with a specific effect. Antonio Pasquale, my friend, proposed the law of bivalence, where every receiver can be a sender and vice versa, and highlights that communication is exclusively human. Paulo Freire of Brazil emphasized dialogue and the exchange of knowledge between equal parties. Maria del Socorro Fonseca described it as sharing something when oneself establishes contact with others. Communication is valued as a crucial factor in the development of personality and information. Furthermore, it is considered a complete social process that goes beyond the simple transmission of messages, involving different forms of communication, such as the media and writing communication. Communication is communion with the persons too. In the field of health sciences, communication is seen as a basic competence to elucidate the patient symptoms, problems, and concerns, and is now to facilitate health promotion and adherence to treatment. It is also essential for a good relationship not only with patient but also with peers. Communication is a learned skill composed of verbal and non-verbal behaviors. The development of these skills includes oral, paraverbals, non-verbals, writing communication, and active listening management. The health system, we can understand, is also a dynamic, complex, and collective process where communication has a transversal dimension to all teams with the power to transform the organizational culture, since it can create and recreate other possible meanings and improve interaction with our interlocutors, publics of interest, and citizens. People who work in health must also recognize their role as social communicators. The hegemonic medical model that still suffers from historical fragmentation and disarticulation. And from that paradigm, communication is thought of as the asymmetric doctor-patient relationship, where the first must translate so that the second will be. And both in the training of health science, and in the planning of daily tasks, communication is not usually included as a discipline of direct intervention in practice, but rather as a secondary aspect compared to the clinical dimension. The role of the doctor also influence doctor-patient communication. Women tend to show more sensibility to the patient feelings and place more emphasis on the social and humanist aspect of care, while men tend to focus more on obtaining information and solving problems. In the health fields, communication is essential to understand the patient's symptoms and concerns as well as to promote health and improve treatment adherence. Therefore, it is essential to teach communication skills from undergraduate to professional practice. Professional preparation must contain the education of skills such as observing, listening, asking, and giving information for effective communication. Additionally, the doctor should be attentive to the patient verbal and non-verbal cues to improve understanding and the doctor-patient relationships. In the basic and socio-medical sciences, students are prepared in general communication skills, writing and non-verbal communication, the importance of a clear and concise expression, both oral and writing, as well as consistent non-verbal communication, is emphasized. Different methods such as size, presentation, debate, and video analysis are used to develop these skills. In the clinic, time spent teaching communication is often limited, but is crucial for professional development. Various methods such as lectures, role-playing, video analysis, and feedback with the real patient are used to improve communication skills. Aspects such as the ability to actively listen, transmit information in clear and emphatic manners, and building relationships of trust with the patient are evaluated. Student interest in learning communication also influences the teaching and learning process, and it is important to recognize that communication skills are equally important as medical and clinical knowledge. Therefore, a positive attitude towards the development of these skills should be encouraged from the beginning of medical training. In conflict situations, the doctors can follow 6 steps to establish good reports. Stay attentive, listening, careful, try to understand the other point of view, respond with empathy, accept our responsibility, and use no aggressive language. Saying no to a demand patient also requires a specific skills. The evaluation of communication teaching can be carried out at different levels. In basic science, the goal is for a student to be able to exchange knowledge, ideas, and emotion in a clear and concise manner. In the end, conclusion, good effective communication in medicine can lead to positive results such as decreased distress and depression in patients, greater satisfaction, better adherence to treatment, resolution of symptoms, improve the final results, reduction in medical errors and complaints, and greater satisfaction of the doctor. Thank you very much for your attention. Thank you very much.